Hi, this is day 5 after day 5 of my recovery from robotic assisted laparoscopic prostatectomy. I should say radical prostatectomy to be precise. And now I'm going to talk about some of the other treatment possibilities that I was offered besides the surgery. And I actually talked about the 4 different types of surgery in a prior video. But surgery isn't the right choice for a number of reasons for certain people. Could be they're too old, number one, they may have a medical condition, a heart or something else that would prevent them from going for surgery because it is a major surgery. So there are other options that a person can take. I would have to say from one support meeting that I went to, probably one of the biggest options, or what I noted there, was about 10% of the people were there on what's called watchful waiting. And they were taking the approach that they were just going to be more closely monitored with their PSA levels, maybe every 3 months or every 6 months. And then once a year, if their levels went higher, they would go in and have another biopsy. And by the way, the biopsies, at least for me, were relatively minor. You just, it takes a couple minutes, you drive home, drive there. I mean, there's no general anesthesia or anything. So it's over pretty quick. It's a little uncomfortable, but that's about it. And then from there, they can take those biopsied samples and look at them under a microscope and compare your Gleason score and see if the aggressiveness of the cancer has increased, stayed the same, or decreased. So that is kind of the watchful waiting program, and that's probably a big option. Now the other options also include hormone therapy, so there's no surgery involved with that. Then there was 2 types of radiation that was offered to me. One was open beam radiation, and the other one was seed implantation. They actually implant seeds directly into the prostate gland, kind of similar to the way they do the biopsy. And those seeds, the radiation, kills all the cancer in the prostate cell, and also kills the prostate itself. So, should you be facing prostate cancer, don't believe that surgery is the only option. By far, it's not, and it may not be right for you. It's something that you definitely have to consult with your doctor and see which way. And that depends on a lot of factors: your age, your Gleason score, if they do a biopsy, and your PSA levels. And probably more importantly, or what was really important for me, was not so much the PSA level itself, but the rise in the PSA level over your prior one, let's say a year or 2 before. What was the rise? If there was a big rise, that might indicate that the cancer is spreading or increasing, or definitely you need a biopsy to see what's happening. But anyway, there are more options than surgery. Appreciate you listening, and make sure you see the rest of my videos. Thanks.